Interpreting the results of testing and the initial treatment. Testing is interpreted by the technician, who will score each reaction on either a 0 to 4 scale, with 4 being the largest reaction size, or can directly measure each wheel and flare size and record the results. If a test for an allergen is negative, the patient is considered not allergic to that allergen. Once this is recorded, then the process of determining treatment options is next. The initial treatment option for any allergy is first trying to avoid, as best as possible, the allergen-causing symptoms. For seasonal allergens such as tree, grass, and weeds, knowing the seasons is important. For most of the country except the Deep South, tree pollen season is generally from March to May, grass pollen season is typically late spring into summertime, and weed season is usually summer into the fall. Tree pollen is at its height in the first early morning hours, so it is advisable to try to exercise outdoors later in the day, if possible. It is always recommended to change clothes before entering the bedrooms and common areas so as not to bring the pollen indoors. It is also recommended to keep windows shut and the air conditioning on during the pollen season, again to keep the outside out and the inside in. Mold is both an indoor and an outdoor allergen and is a common allergen. Certain molds such as Alternaria and Aspergillus are more commonly found outdoors and can increase symptoms of sinus infections and asthma. It is important to keep the humidity inside the home below 50%, ideally at 40%, to reduce mold growth in the home. Removing carpeting is also very helpful, as carpeting acts as a reservoir for mold as well as pet dander. Pet allergens are lightweight allergens and can remain airborne for hours even after a pet is no longer in the room. Pet allergen usually comes either from saliva or dander, which is skin, that is aerosolized and then breathed in by the allergy sufferer. So, keeping the pet at least out of the bedroom is helpful, as is keeping the skin of the pet from drying out. In fact, studies show that simply taking a damp washcloth and rubbing the pet once or twice with it will reduce the amount of allergen that gets into the air by up to 50%. There are now also special foods for cats specifically that reduces the amount of the major cat allergen known as FeLD1. And a room air HEPA filter may be helpful in reducing the airborne allergen for pets, as they are lightweight allergens and can be more readily filtered than heavier allergens such as pollens and dust mite. Dust mites are microscopic insects that generally live in fiber stuffing, pillows, mattresses, couches. Their highest concentrations are in pillows and mattresses, as they live off of our dead skin that we shed into the bedding. Dust mites do not drink, but live off of ambient humidity, so lowering the humidity in the home can reduce their amounts. It is also recommended to place special dust mite covers over the pillow, mattress, and box spring to further reduce exposure. Medication therapy is next, and is typically the next option for most allergy sufferers. These include second-generation antihistamines such as cetirizine, loratadine, levocetirizine, fexofenadine, and desloratadine. These generally non-sedating medications are useful for controlling sneezing, nasal and ocular itching, and rhinorrhea, which is runny nose. They are not generally very effective for nasal congestion or postnasal drip, but may have some effect. They can be used daily and continuously if needed for symptom control. Nasal steroids such as fluticasone, mometasone, triamcinolone are also mainstays of treatment for most chronic allergy sufferers. These medications need to be taken regularly for optimal effect. They generally take a few days to begin working and about a week before having maximal effect. They are useful for a broad spectrum of symptoms, including congestion. Nasal saline rinses may also be used to keep the nose free of allergens. Nasal antihistamines, such as azolastine or olopatadine, may also be used alone or in combination with nasal steroids for added control of symptoms. Each of these medications are safe to use both short and long term and can be used seasonally or perennially. If a patient has seasonal spring or fall symptoms, it is recommended to start the medications 1 to 2 weeks prior to the onset of the season to allow the medication to work prior to the onset of symptoms. This is more effective than waiting until symptoms begin for treatment. Additional medications such as pseudoephedrine, nasal vasoconstrictors such as Afrin or Sinex, and other medications similar to that should only be used for a short time, no more than 3 days, to avoid potential side effects.